Here at the Cheshire Dartmouth Health Family Medicine Residency, we're looking for residents who want to be a part of creating solutions for rural and underserved patients.
We really need to have people who will be open to new ideas, new ways of doing things, having a vision of where they think things ought to be.
We are going to cover the breadth of family medicine, everything from cardiology to reproductive health to neurology and surgery and everything in between. That would let them, go into a rural community anywhere in the country and be able to provide comprehensive medical care to all ages.
We're trying to have a strong emphasis on going more towards independent learning, right? And helping residents craft an educational experience that's going to help them be prepared for the specific career that they want. There's not other residency programs, there's not other trainees here that are competing for learning experiences. And so our residents can really be everywhere in the hospital, both learning from, wonderful family physician faculty, but also specialists in all different areas.
I have the benefit of being able to communicate directly with the specialists, and I know them from not only the hospital, but also the community itself. And so they've been a really nice resource for patient care and my own learning too.
Being part of the larger Dartmouth system allows you to have access to some of the extra specialization which you would not find in a community hospital, but you find within a health system.
Cheshire Medical Center has always played a huge role in this community. We are the community hospital where everyone goes.
You have a wide breadth of patients who will come here, everything from, kids, parents, grandparents, we see it all.
Practicing here in the rural setting, it's a real sense of community where you're caring for your neighbors. I would frequently run into patients in the feed store. It leads you to want to stay here and grow with the community and the medical system that's here already.
Keene and the Monadnock region are really the perfect place to both work but also to live. We have Mount Monadnock right in our backyard. We have the Connecticut River just to the west of us. It's easy to pursue outdoor activities and things you love no matter what direction you go.
We're 2 hours from the ocean. We're 2 hours from the Whites. We're 2 hours from Boston.
I went to medical school in Arizona, and my wife's family's from Massachusetts. Together, we've always wanted to come back to New England. There's always something going on in town. It's never a dull weekend in Keene. For family kid stuff, there's tons of parks in the area. Wheelock Park has a phenomenal playground. The YMCA here has a fantastic preschool daycare program that both our kids attend.
Keene is almost like the perfect training environment. A city of 23,000 presents a lot of opportunities that you might miss out on in either bigger communities or smaller communities. We're lucky today to be talking inside our new clinical space. We were able to craft a space that really prioritized both outstanding patient care and a really strong educational experience.
I saw the potential from the very beginning. Like everyone who came here, they wanted to be a part of something new. And they came with that intentionality and that focus. You can really see how it's going to build and sort of be something that's really new and different in family medicine training.
We've implemented things like a longitudinal curriculum that better simulates clinical practice and gives repeated exposures to different clinical learning environments over the course of their training, so residents can continue to develop their knowledge and skills and build on them in a scaffolded way that better simulates what actual practice looks like.
Our curriculum and assessment process is grounded in a competency-based medical education model that's endorsed by the American Board of Family Medicine and the ACGME. And this model focuses on developing specific competencies in our medical residents rather than simply completing a set period of training. And the assessment is continuous and formative, with trainees having flexibility to progress at their own pace. We're going to have some close ties with the women's health services that are already existing at Keene through the midwifery program and through the OB-GYNs that are already here.
We really want to integrate a strong focus on care for LGBTQ plus populations, particularly in rural areas. That can be a group that's really underserved.
We're going to be providing integrated behavioral health here in the new clinic. During a regular patient's appointment with their primary care physician, I can sit with a resident and do shared care, listening to the patient, figuring out how to get out of their way so that they can move forward towards their goal of living their best life and having good health.
The faculty and the staff here are your resources, and we want to support and we want to help and assist in any way we possibly can, and all you have to do is ask.
You're not in this alone. I've had residents call me in the middle of the night, which is always going to be an open phone call, and I know that that's true for our faculty too, that if you are really struggling, we would be here for you. this is training and this is a time of learning, and this program's going to support you through that process.
One of the things that I really love about working here is that I think that it's a really supportive group of people who all have a good shared mission of balancing work, but also our own home life and well-being. And I think that that's a bit rare in medicine.
I'm really excited to watch our first several classes move through the program, really start to take on more ownership of each part, and help us continue to refine and improve the program. Much of what we're doing is on the leading edge of residency education, and we're in a unique place to really train the next generation of family physicians.